Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea. The main types of sleep apnea are obstructive sleep apnea, central sleep apnea, and complex sleep apnea syndrome, which has features of both. Obstructive sleep apnea occurs when the airway at the back of the throat becomes physically blocked. That obstruction causes temporary lapses in breath. Air has to go from the nose through the nasopharynx into the laryngopharynx, through the larynx, and then into the trachea. Somewhere along that path, there might be a blockage in the flow of air. The major risk factors for obstructive sleep apnea are obesity and male sex. Obesity predisposes to obstructive sleep apnea through the narrowing effects of upper airway fat on the pharyngeal lumen. Allergies might cause swelling of the tissue in the nasopharynx, or there might be swollen adenoid glands or tonsils because of an infection, and smokers are 3 times more likely to have obstructive sleep apnea than are people who've never smoked. Smoking can increase the amount of inflammation and fluid retention in the upper airway. Now, central sleep apnea happens because there is a problem with the brain system for controlling muscles involved in respiration, leading to slower and shallower breathing. Central sleep apnea starts with an initial episode of hyperpnea, which is when the brain directs the lungs to start hyperventilating during sleep by increasing the respiratory rate. This rapid breathing causes hypocapnia, a drop in the blood's carbon dioxide levels. When the carbon dioxide falls below a certain threshold, the body slips into a state of apnea, making no effort to breathe and taking in no oxygen. This causes the carbon dioxide levels to rise back to normal levels, and then, as the apnea persists, they keep rising to which is called hypercapnia. The really high carbon dioxide levels trigger hyperpnea again, and the cycle starts all over. The repeated awakenings associated with sleep apnea make normal restorative sleep impossible, making severe daytime drowsiness, fatigue, and irritability likely. Sudden drops in blood oxygen levels that occur during sleep apnea increase blood pressure and strain the cardiovascular system. Having obstructive sleep apnea increases your risk of high blood pressure. Obstructive sleep apnea might also increase your risk of recurrent heart attack, stroke, and abnormal heartbeats such as atrial fibrillation. If you have heart disease, multiple episodes of low blood oxygen can lead to sudden death from an irregular heartbeat. Sleep apnea on its own is rarely fatal, but it can worsen other health problems. For example, drops in oxygen levels can trigger anginal chest pain and can irritate heart cells, leading to an arrhythmia, an irregular heartbeat. Broadly speaking, individuals with sleep apnea have a higher risk for heart failure, respiratory failure, diabetes, and certain types of cancer.
Do not forget to like the video and subscribe to our YouTube channel.